My name's Denny and I've been in the fitness industry for 20 years. I'm a yoga teacher, fully qualified, and fitness instructor. And I'm just going to give you a couple of tips if you have sciatica. Please don't run off to the doctor. The doctor doesn't know what to do. He's just going to give you painkillers, and it's really not the right way to go. What we really need to do is to work on our own body with stretches, breathing and focus. If you've got sciatica, you're probably doing something on a regular basis that's repetitive, either standing all the time or lying on your sofa on one side with one leg squashed under the other. It could be anything. So, just take a look at your life and see what could be causing it. Okay, so let's just go through a couple of tips. We have 3 hamstrings at the back of the legs, and they actually emanate from the base of the spine here. Now, one of the hamstrings goes right down the back of your buttock, down the back of the leg. Another one of them comes out to the side and to the outer knee. They all sort of meet at the back of the knee. And then another one comes from the spine again, but down the inside of the leg. So you could feel sciatica in any of these places: hip, bottom, leg. Now, what we need to do is we need to stretch the particular nerve that's causing us a problem in the back and throughout the leg. So, firstly, I know it's difficult when you've got sciatica to actually even move about, but you need to get yourself on the floor. You can do it on your bed, and you take your legs out straight. And a nice easy way to sort of open out first is to start rocking from side to side, from bottom cheek to bottom cheek. Now, I've seen a lot of sciatica sufferers that can't even bend their body forwards any more than that. So if you're struggling with bringing the rib cage forwards, then just hold your hands behind you and keep wobbling. So you're massaging your muscles and your nerves right into the ground. And then you want to get hold of a tie, a scarf or something to put it around your feet. Now, once you've done that, you'll be able to pull your upper body forwards. We want to feel length through the spine, and we fold forwards from the hip, and then you can do some rocking from there. Now, another thing we want to do is try to pull the rib cage forwards. The base of the rib cage comes towards the thighs, and this may be difficult for you at first, and you have to practice every day. You have to stretch out every day in order to rid yourself of the pain. I'm going to turn around here. So, straight legs. While you're watching the telly, anything like that, you just lift your rib cage, bend forwards, rock from side to side, and do that for about 5 or 10 minutes. So another one we can do, especially if it comes down the outside of the hip, is to take one leg across. You keep your bottom leg absolutely straight, stretching through the knee, pull the toe back on the bottom leg. The top leg is just relaxing. So you can either push from behind and breathe slowly. If you put a pause on each end of your breath, you breathe in deep and pause, and you breathe out deep. Fully breathe out, belly squeezes and pause, and you'll feel the back of that leg pulling through. And of course, anything that you do on one side, do it on the other side. So it's your leg that has the sciatica on the bottom. It's the bottom leg that's doing the work. And then another thing to do is to stretch your inner leg. So if you have that sciatica that comes down the inside into the inner knee, bring your legs in here. We breathe in, we lengthen up. Now, at first it may be difficult for you to come forwards. You could always lean your back against a wall and start pushing your knees down into the floor as you push your back against the wall. That works. Or if you can hold your legs, just coming forwards there, and again breathing in slow with a pause, and breathing out slow with a pause. And you don't want to go to the point where you're in pain. You just take it to an edge and then find yourself growing deeper within it, using the breath to allow you to open more without any effort at all. So that's for sciatica on the inner legs. You can also try this one. Take your legs out as wide as they will go, comfortably. And it's important that you contract your knee muscles, so you push them down, you pull your thighs long, and then you either push from behind as far as you can go, stretch out your toes, make your big toes face the sky, and you can walk forwards and you just breathe slow and deep there. You should feel your buttocks contracting as you lengthen your thighs away from the hips and your knees away from the shins. A lot of people that get sciatica actually are probably, apart from some sort of repetitive strain, allowing their buttocks to become too weak. That's often another common cause. So you can do any buttock strengthening exercise, and that will really help too. Take one leg across your leg here. You can pull that leg up towards you. If you put your crease of the elbow onto your foot and then hug that leg in towards you. Of course, if you're really in pain, then you're just going to have to hold one foot, one leg, and then just bring it up in your own time, very gently and slowly. So we do that on the other leg as well, of course, just to keep some sort of symmetry going in the body. Another good one for the outer hip sciatica is to come and lie down, and then you put one foot on the thigh, arm out to side, and then you take the opposite arm and take that knee over. You can lie down, and as you bring that leg across, you can feel lengthening in your straight leg. And you just breathe again, deep and slowly. Until you feel that the pain has subsided. You know, I'm going to do it quickly on the other side. Of course, you might need to spend longer in the postures than I'm doing here. You take the leg across, the foot is on the thigh, and you take the leg over. You might need to do it tiny little bit at a time. Be careful that you don't overstretch. You don't take your body into a place where it doesn't want to go. You don't want to hurt yourself. Keep your straight leg lengthened. Keep your waist lengthened there. And then other really good exercises for sciatica are actually to loosen off your lower back. So if you wanted to do the cat, you would just round the spine and then arch the spine. You breathe out, on exhalation you're rounding, and on inhalation you're arching, lifting the head, lifting the bottom. You do that a few times until you feel your back loosen off. We could also try twisting while sitting. So you sit up nice and tall, and then you take opposite hand to the opposite leg and the other hand behind, and you twist in the spine here. It might be beneficial for you to take the foot over by the knee and then pull this leg in as you twist. If you're supple, you can take the whole elbow open and then twist while you're pulling this leg in. And of course, I need to do it on the other side. So you're going to either hold it here and pull it in and twist as much as you can, or take your arm over, lengthen up through the spine and twist. And then other good things to do for sciatica are to come down on the floor. You could try like this, so that we take hold of a scarf or a band, and you take one leg straight here, and then you start pulling it towards you. This might be better for people who are really suffering, who really can't even sit up straight. And if you point and flex your toes while you're doing that, you're going to get some manipulation right down the leg up to the hip. I'm going to do the other one. These are just guides. We're not actually doing a class here. I'm just giving you some exercises that you can do at home to say if you're going to the doctors. Stop you taking medication. There's really no need to take medication for sciatica. There really isn't. Sometimes I cringe for people when they say I went to the doctor for my sciatica, who gave me painkillers. I just, wonders never cease. So that's it really. You can always try and contact me on Facebook. My wall's open. My name is Denny Burfield. Or you can even perhaps ask some questions in the YouTube comment boxes. And wishing you a lovely day, wishing you utmost fitness and health. God bless.